the launch of the investment case for the prevention and control of non-communicable disease in Thailand. The investment case for NCDs is national assessment used to provide the economic rationale for investment for the prevention and control of NCDs. It also details the national impact that scaling up this investment in prevention and treatment have in the long run. The investment case can be used to showcase the benefit of scale-up action to relevant decision makers and as advocacy piece to raise interest and investment for NCDs. The burden of NCDs placed on the economy can be viewed as an iceberg. The top and visible part representing direct costs such as how much the government spends on healthcare. In Thailand, the government spends 139 billion Thai baht on healthcare. The bottom and largest part of the iceberg represent the indirect costs such as reduced productivity and loss of workforce. These hidden costs are 11 times higher and equate to about 1.5 trillion baht, mainly due to loss of workforce. The economic analysis consists of 4 steps: estimating the economic burden of NCDs, assessing of the health impact of interventions, costing of these interventions, and analysis of return on investment. The total economic burden of NCDs on the Thai economy is 1.6 trillion baht. Government healthcare expenditure represents a tiny fraction of all NCD-related costs. In Thailand, the impact of investing in policy and intervention package for the most common NCDs and their risk factor were assessed: tobacco control, alcohol control, salt reduction, diet and physical activity, cardiovascular disease, chronic respiratory disease, and diabetes clinical intervention. The alcohol-related policies are expected to have the greatest impact, almost 115,000 lives saved, while scaling up the clinical care package would be expected to save nearly 100,000 lives. Policy packages: salt reduction, tobacco and alcohol control, and physical activity are the clear best buys from an economic perspective, offering the highest ROIs over 15 years. In summary, NCDs in Thailand cost 1.6 trillion baht, with over 90% of this as indirect cost to the economy. The report concludes with 7 actionable steps that Thailand can take to strengthen a whole-of-government, whole-of-society approach to reduce NCDs and their adverse consequences. By acting now, this investment will contribute to the overall development of Thailand with positive ripple effects, accelerating economic growth and social development in the country.